like, the kinetics of it might actually be reduced if we do that.
Yeah.
And there's even evidence that I think you sort of presented suggesting that, like, the more you actually are trying to create a specific movement, the lower the output than if you, and it was using the cueing.
I bet say it's related to cueing.
Like the difference between internal and external cueing.
Yeah.
And if you use internal cueing, you actually see reductions in, say, force output,
even though EMG activity is higher.
Yeah.
And that's an interesting conundrum, I think.
Yeah, like the EMG, certainly it's way too simple to say, oh, it's activating more, therefore this is a good exercise or that's a good exercise. Because, and I think we've chatted about this before, Jack, but your activity in those research papers is relative to the force produced by the muscle. So you test the maximal force, say, of your pec, for example, and then you say, when we do this exercise, it's working at this percentage of this muscle's maximal force. And so it's normalised to itself. And so if you have a deficit in that muscle, like, it doesn't tell you anything. It doesn't tell you have a deficit, because it basically is saying, oh, you're still working at 90% of that max force, but in fact the max force is
low compared to what it's capable
That's right.
of. Yeah.
So you've got to understand that about EMG research, and certainly with ours, we've moved well away from that, and we look at more the patterning. So we actually look at when it's working relative to other muscles, and try and get a bit more, because I think that tells you more about control overall of a joint. So your question about should it be focusing on that particular muscle, or should you just be focusing on the movement
and the deficits?
Deficits. I mean, I think probably in a lot of situations either could work, and that's where we go back to that clinical reasoning. What's going to work for that patient may not. They might still get eaten by the tiger if they were back in those days. But if there are those other things, if there's fear of movement, if there's inhibition of muscles, because you do see that, like, some people just get crazy inhibition and really strange motor patterning really quickly with pain, and I think you can tell those people, just move and do this and do that. There's no chance that they're going to improve.
Well, and I also think too of even peripheral changes and how that influences sensory motor output. Like, there's quite a bit of research done by Carla Stecco, and actually there was a recent paper that she published with Paul Hodges of looking at changes within the connective tissue network following injury, and how that influenced the behaviour of the muscle spindle. And so what that study found specifically was the muscle spindles were much more located at the perimysium within the connective tissue, and following injury, and particularly if you have disuse, you're likely going to get some fibrotic changes. That it influences the muscle spindle to actually function properly, to then send that proper signal back to allow that alpha motor neuron to actually be recruited. So it's like, that to me was just like, okay, well, there's a couple of things. One, motor control continues to be more complex than you first think. But also two, of thinking of, I often think, are we missing half the equation when we use the term motor control as opposed to sensory motor control? And I often think about that too from a manual therapy standpoint, because someone comes in with shoulder pain, they're like, that's as far as I can move it. You do some manual therapy and they're like, oh, okay, that feels really good. Now that might just be a transient change, the next day they're like, oh, it's worse again. But clearly you've changed something there, and part of that obviously has to do with potentially sensory input, because you've changed the, say, viscoelastic behaviour of the tissue, not to mention central input, because the patient likes the fact that they've been touched and they feel confident. But yeah, it's like, that sort of highlights to me too of like, well, why do I think this person's motor control is impaired in the first place? Because the reality is there's potentially an endless amount of things. Well, there's obviously a limit, but then I'm thinking, is it a sensory factor? Is it related to a motor output?